Hi, Gummies. How are you doing today? Thank you for tuning in for another episode of Bumping My Gums. As you can see, we have a guest with us today. You may recognize her from a previous episode. Miss Taylor, would you like to introduce yourself or reintroduce yourself for some?
Hello. Hi, Gummies. It's Taylor Burge. I am back, and I am the CEO and one of the providers at Wilmington First Walk-In. And thanks for having me back. It was
Yes.
really nice to see you.
Yes, it's good to see you too. I appreciate you for accepting the invitation because I know you're busy. I know things are pretty busy. But any updates about Wilmington First that you would like to share with the Gummies?
So Wilmington First Walk-In is growing by leaps and bounds. We're so excited. We're really feel like we're helping a lot of people in the community who otherwise wouldn't have care. So we're really excited about everything that's going on around here. Yeah.
So give everybody the location so they know where to find you.
So Wilmington First Walk-In is at 4001 Miller Road. We're Suite 1, and we're in Wilmington, Delaware, 19802. We're right next to the Gentle Smiles Pediatric Dental Office. Everybody already knows that. Mm-hmm. And then across the street from the Home Depot in North Wilmington. So that's where we are.
So I wanted to have you back to ask you some questions about this whole coronavirus / COVID-19 / pandemic / ruining our lives. No, just
/ stay at home, don't go out.
Yes. / don't let nobody breathe on you.
Yes, wear a mask.
So
okay.
What exactly is COVID-19?
So COVID-19, the reason why it's named the way that it is because it's a coronavirus. Coronavirus has been around for a long, long time. But the coronavirus COVID-19 version has only been around since 2019. So it's a novel virus, and novel just means that it's new and that we've never seen it before. And so it is a virus like many other viruses. However, the way that it acts in the human body is what makes it very distinct and makes it very harmful. So coronavirus is literally just a virus. Most people will be able to get through it like a normal flu, kind of upper respiratory cold that most people have. But it's a virus just how anything else is. Kind of the interesting thing about COVID, honestly, is the way that it affects the lungs so drastically. And so it's just a virus, believe it or not. It's just a virus.
But what makes it so deadly is the fact that we don't have a cure for it, right?
Well, not only. So majority of the viruses that you encounter are, they don't have a cure. Mm-hmm. HIV is a virus. Hepatitis C is a virus. Mm-hmm. So majority of the viruses that you have, there is no cure. Even for flu, we have Tamiflu. But what Tamiflu does is shorten the course and lessens the severity of flu when you get it. But it's no cure. The cure is your own body. So the human body actually attacks the virus itself when it's introduced into the body. That's why you got a fever. That's why you don't feel well. And your symptoms come from that interaction between the virus and your immune system. Mm-hmm. So there's no true cure except for your body to fight it off. And that's what makes the coronavirus so unique, is that it is stronger than people's immune system. And that is what causes, unfortunately, the deaths that we've seen.
Okay. What will it take to kind of get things back to normalcy, so to speak?
So that is a difficult thing to answer because we don't know how it's going to act. So, for example, flu, we know it's coming back every single year, and we can kind of guess A strand, B strand, which one will cause an issue. And even sometimes we get that wrong. But in order for us to get back to normalcy, from what we've seen so far, is the distancing, the social distancing is so important, because it lessens the amount of exposures that a person has to the virus. And that's the only thing that we can do right now. That's our only protection. And so it's important for people to recognize that there is no medication that we can give right now to get rid of it. There's no vaccination, so that's not a possibility. Those are usually the ways that we kind of try to decrease or mitigate the viruses that we actually have come in contact with before. But unfortunately, this is so brand new. This virus is months old. So it's there's no cure. There's only what we call symptom management. And that's what we do for viruses. So like when you get a regular cold, your doctor gives you, or nurse practitioner, your provider gives you Tylenol for pain or fever, gives you a cough medication for your cough. And that is what the treatments consist of, is to make you more comfortable. The issue with the COVID-19 is that it makes you very uncomfortable, and there's not much that anyone can do about it, because the discomfort comes in the form of shortness of breath and not being able to breathe and having an uncontrollable cough. So there's not much that we can do as far as treatments, other than to control your symptoms and to make you as comfortable as possible. Other than that, there's no medication that we can give you. Tamiflu doesn't work, for example. So in order for us to get back to normalcy, it's just waiting for the virus to spread less and to lessen our exposure to the virus, so we don't actually get the virus.
Yeah. That's the thing that's kind of scary about this thing, because, okay, so now we're social distancing. Well, we're supposed to be. So we're social distancing now, that's what they're telling us to do. But I think everyone's fear is, because there's not a cure or anything, number one, we don't know when the outside is going to open back up, as some people say. And the fear is, if we do it too soon, then there's going to be a resurge, and then we'll have to go back through this all over again. So that's kind of, I think, the fear that we're having. So can you speak to that concern? Do you feel the same way, that once we go back to playing outside, there could be another spike, and then we'll have to come back into the social distancing again?
Yes, I call it the second wave, because I'm expecting that once people can congregate again, and the virus is still present, it will spread.
Yeah.
Because you can get it from hugging your sick friend who hadn't done all of the hygiene measures that we try to get people to do, washing their hands, sneezing into the elbow, which is also called the cheladon. So sneezing into the cheladon. Okay. So, if you want to be fancy, excuse me, may you sneeze into your cheladon. Yeah. And making sure that you're using the hand sanitizer if you're out and you can't wash your hands and those sorts of things. If someone is coughing, if someone is feverish and you're with them for what they call a prolonged amount of time, you increase your exposure to the virus. So it's going to be very easy for it to spread. And my concern is that we do go back to life as usual, and then it spreads again, because the focus has been on getting back to financial health rather than actually physical health and well-being. Yeah. And so that is a concern, especially in the medical community, because we've done such hard work. We've put in so many hours. We've, you know, held people's hands with our gloves on, of course, you know, comforting people who've lost loved ones and who can't go where they would like to go, and, you know, people who are becoming depressed because of the situation that we're in, and we're just going to go back to it. So that is a very real concern for many of us, especially in the medical community, because even here in our clinic, when COVID first surged, we were so busy and swamped and trying to make sure that we took care of as many people as we possibly could. So we don't want the resurgence of this again, because as we talked about already, there is no cure. It's simply making you comfortable, and no one can predict which strain you're going to get. Are you going to get one that's a little lighter and just kind of sore throat, stuffy nose, runny nose sort of a thing? Or are you going to end up on a ventilator in the hospital, which no one wants at all?
Right. So you mentioned that there's different strands of the COVID-19. So is that
Yes.
the reason why some people test positive without symptoms, and then there's people who test positive and they do have variations of symptoms?
So the strains will affect the severity of the symptoms, but also the immune status of the patient will determine their symptoms. So as far as testing goes, whether you're going to be negative or positive, that is something that is still an unknown, because there are people, say celebrities, who are going to get tested who are without symptoms or asymptomatic, and they are testing positive. And then we have patients who we test positive, have had a known exposure, a positive exposure, and they still come back negative.
Mm-hmm.
And then the next week they're sick. They then come back positive.
Wow.
Because it was too early to detect their symptoms. So it's so very that there is no clear-cut answer for that. And the research just isn't there. There's not enough data to help us to understand the virus in that way yet. And that's what makes COVID very unique now, is the amount of damage that it has done and the limited amount of information that we do have about the virus.
Right.
And so I've been in the healthcare field since 2007, and we've never seen anything like this before.
Yeah.
So we're all experiencing this together. So when they say we're in this together, we are totally in this together. And so that's why the social distancing is so important, making sure that we're taking care of each other. If someone doesn't have anything to eat, or if they need, you know, help with their bills, or they need anything, that's the best thing we can do, because we have to stay home until this thing starts to fade, and until it starts to go away on its own, and until we have passed our danger zone, so that way we don't end up in a really tight spot.
Okay. So you mentioned testing. What does the testing look like?
So testing is the swab up the nose. They also have oral swabs, but the nasal swabs are the best. So it is a very thin swab that gets placed up in each nostril. We swirl it around inside of each nostril.
You gotta do both?
Oh yes, because we're going to get a good sample, because we don't want a false negative, because we did not do our due diligence in getting the swab. It is not going to just be at the tip of the nose. It is going to go a little further inside, so that way we get a good sample. So we can send it over to the laboratory, because if there's not enough sample, it will return that there was not enough sample in order to perform the test, because they actually run the test twice. when they perform it at the laboratory.
And how long does it take for the test results to come back?
So right now we're seeing 24 to 72 hours, so 1 to 3 days. There was a national backlog before, which had it about 7 to 10 days, but the labs have really kicked it up, stepped it up, and turned it around. So now everyone is getting their results typically within 3 days at the latest.
I know too, there was a time where it was hard to get the test kits.
Yes.
And so therefore the requirements on getting tested for COVID was limited. Is that still the case?
It is the case. The testing supplies are still very low. It's a national shortage of the test kits. And so majority of the folks who are doing testing, we get our testing from the state of Delaware directly. And it makes it where we don't test every single person. We are testing the people who we are more suspicious for. A lot of people want to come in to be tested just to make sure they don't have it. But that's the concerning part, because I test you now and you don't have it, then you develop the symptoms of COVID. I don't have a test anymore to test you. So it's definitely more prudent, and it's actually smarter to test people who actually have symptoms. And so the symptoms have changed. So before it was you had to have a cough and shortness of breath and or fever and have traveled outside of the country to the listed countries that were on the CDC website. However, it's now changed that diarrhea is a symptom, sore throat is a symptom, sinus pressure is a symptom. So there are developments throughout this time. Where we were 1 month ago is definitely not where we are now as far as the symptoms and what we understand of the virus. So we do test a lot more people than what we did when we initially started, because the understanding has expanded and so has testing.
Okay. Yeah. To me, that's kind of the scary part, because I've heard of people who are saying that they have certain symptoms, and then depending on who their doctor is, they're like, oh no, that's not what it is. It's something else. But it's like, well, is it? You know, is it something else?
Well, is this?
The symptoms change so much. I'm just saying.
Every day when we first started, every day something would change, and it's kind of trying to hit a moving target. So I know here we started with the very strict criteria, which was recommended by the CDC and the state of Delaware. Initially, before you could test someone for COVID, you had to call to the state of Delaware to ask if you could test, because it was thought that it's a very isolated set of patients who would have the condition, and that quick evolved to where we are now, where we all get test kits. If as a healthcare facility, if you're willing to do the testing, a lot of places don't want to do the testing because it does put you at risk when you perform the tests. It puts you at risk of contracting the virus yourself. So you get your test kit, you do your testing, and hopefully protect as many patients as you possibly can. And we're trying to be smart with our test kits to make sure that we have the availability. So if you get really ill, we can test you for COVID and know exactly what's going on, because heavens forbid you can't breathe, you're coughing really bad, you have a really high fever, and there's no test to say this is what you have. So we waste a lot of valuable time looking, do you have pneumonia versus COVID, or is there something else going on? And then you kind of lose a couple of days. And sometimes that can be very critical, and sometimes that can be life-threatening. Right. So it's important that we make sure that we're doing, we're using our best judgment on these things. And I never want to leave a patient without a diagnosis.
Right.
So, a patient coming in with, sore throat and stuffy nose, yes, that could possibly be strep. It could be flu. It could be mono. So what we do here is we look into all of those things. We don't just test for COVID. We don't just test for strep. We look into everything and put it together as a clinical picture rather than just saying, well, no, this likely isn't that.
Right.
I don't like likely. I like more definitive answers. And that's the interesting part about COVID is there aren't definitive answers sometimes, but we definitely chase after that answer to make sure that we can give our patients the best chance of improvement.
So when a person does come back positive, do you have to put together like a timeline of where they've been? Is that a CDC requirement that you do that? And does the CDC require you, not you, I mean a person who tested positive, are they required to reach out to people to let them know, hey, I tested positive, and since we were in contact in the past 2 weeks, you should get tested too?
So yes, what happens is the state is informed of all positive COVID tests. They are also aware of all the negatives as well, but they are they're provided with the names and all the contact information for all positive patients. So we as a clinic here at Wilmington First, we call our patients and inform them that they are positive. If they're in a business setting or say they're working or they run a daycare or they're a healthcare provider, they are required to inform like their bosses and everyone that they can't come into work because once you're positive, you can't go to work for 14 days at least. And so the state of Delaware does what they call contact tracing. So you as a individual are not required to call and inform everyone. But what you are required to do is to inform the state of Delaware or your public health center, wherever you live, you're required to inform them of where you've been, such as restaurants and have you been to the doctor's office. And once that happens, whoever has been exposed to you through those avenues will be informed. So, for example, if you went to a restaurant at 12 o'clock, they will say, okay, who was there at this restaurant at that time and identify as many people as they possibly can. And then those people will be informed of the fact that they have been exposed. Then say, for example, here, if you were in the waiting room at the same time as a COVID positive patient and you were within a certain distance of those patients, 6 feet, then you would be informed. So that's why here at the walk-in center, we place you into a room immediately. So that way you don't have to get that call that says that you were exposed. So as soon as you come in, we rearranged our waiting room. So that is another update to ensure that people are 6 feet apart. We don't have the arrows. We probably should get some arrows, but we don't have the arrows yet. So we make sure that you are 6 feet apart and that whenever you're completed your paperwork, especially for new patients, because those patients have one form that they have to fill out. And after that form, you're placed directly into a room. And there's additional cleaning measures like making sure that you're spraying your disinfectants inside of each room after every patient leaves, cleaning every single surface, and making sure even you're spraying the air in your waiting rooms. And very often, if you come through, you'll see us wiping everything down, including we have our keys that you sign in on, which is an iPad. And we can that after every patient because we want to make sure that there's no cross-contamination or anything. So yes, the state of Delaware will help you with your contact tracing, but they do the work for you. You don't have to call and inform anyone unless it's personal. So some patients will call, to their family members, hey, you're going to get a call because I did test positive for COVID, and I just wanted to inform you because you're going to get a call from the state of Delaware.
Okay. There has been mixed information about grocery shopping, or anytime you go outside of home, or if you're doing home deliveries or just coming in contact with other people. Some people say it's a good rule of thumb to come home and change your clothes. It's a good rule of thumb. There's a whole YouTube videos out there to bring your food home and wipe every single thing down, throw your bags away, and things of that nature. What is your thoughts in reference to that? Is it necessary to be that extreme, to basically come home, take off your clothes and jump in the shower and bring all the stuff with you and wash it in the tub too? Like, is it necessary to go to that extent?
So I'm not a good person to ask that, because as healthcare providers, that's what we do. As soon as I get home, in the garage, everything comes off. My jackets are cleaned regularly. My stethoscope between every patient is clean. So I don't think it's extreme. It's just infection control, because you want to make sure that you're not bringing this thing in. So wiping the carts, using your sanitizer, using gloves appropriately. Gloves have to be changed very often if you're going to use them. I have seen folks use a pair of gloves and hand sanitize the gloves, and that's not necessary. That's not it's not what we would want you to do. It's not an appropriate use of gloves at all. So in our household, when we go shopping and we get food, we do clean our fresh vegetables and fruits. We put them in, a apple cider vinegar wash and those sorts of things, which is a normal occurrence.
Right.
But we are not wiping down, the boxes. I've seen people like wiping down boxes and those sorts of things, and you can't quite tell who has touched what. And I also always get my boxes from the back because that's where the newest product is anyway. But if the grocer has COVID and has been coughing and is, rubbing his or her face, then, the virus will be there. A lot of the science has said that majority of the transmission is airborne, and it's a lower risk of you getting by contact, which you would get from touching a soiled surface. However, there have been cases where you have patients getting sick from contact, but a lot of it has to do with airborne. And that's unique about COVID as well, is you have to remain 6 feet apart, whereas even for the flu, you're 3 feet apart. So that's the most important, is wearing your mask and making sure that you're cleaning your hands, sanitizing, and not touching your face at all. I like to hold my own hands so that way I don't touch my face.
Yeah.
And I do change my clothes directly, and I get into the shower before I touch any surface in my house after I leave work.
I was wondering about the homeless. How are they being served and tested?
So, not very well. The homeless, unfortunately, unless they go to one of the roaming testing sites, are not, there's no specific targeted effort to make sure that those patients are being tested. So the messaging that we're putting out is, if you are sick, come by. So we're trying to meet people where they are, like on Facebook and Instagram, so they know that we're here to test them. And we do share the information about Christiana Care's roaming testing, so that way people are aware, because there is no competition when it comes to the health of our community. We feel Wilmington is our community, and that this is where we want to be. So we want to make sure that every person in Wilmington can get a test if they need a test. And so we share their information. Anyone who's doing testing at all, if we see it, we definitely share, because we want to make sure that people have access to care no matter who is providing the care. It does not matter. This pandemic really has shown us that we need to push together, honestly. So unfortunately, there is no targeted plan for the homeless that I have been made aware of at this point.
Are the tests covered by your insurance?
Yes. So the federal government has pushed the insurance companies to provide the test for free. So as far as we were made aware, the test was $31 at LabCorp. So say you had no insurance. However, they're running the testing for free. So for example, if you come here to the clinic, you pay us to evaluate you, and then you have no further cost after that, because we send it to LabCorp, and it's a free free test at that point.
Okay. So it's free whether you have insurance or not for the testing, or is it just if you have insurance?
So the government, federal government, has said that all COVID testing supplied by any vendor has to be free.
Okay, I got you.
And so they also have said that the evaluations would be free as well, but they haven't quite figured out how to make that portion happen. But my understanding is that they have worked with the private sector, which would be your LabCorps, your Quests, and those sorts of labs, to make sure that they're free. Your insurance pays for it.
Okay.
So it's not that it's just a free test and no one pays for it at all.
Right.
LabCorp is reimbursed by your insurance company. So for the folks that do not have insurance, the federal government is supposed to work out a deal with the lab companies to make sure that patients are able to get their testing for free. So anything else around that, which is confusing. So your evaluations, when you do your telehealth with your provider, or even here with us, it's not free, but the actual laboratory test is free.
Okay. What can you do to boost your immune system? Is there certain food you can eat in order to kind of help spice things up, or what tips do you have?
So vitamin C has been recommended, and zinc has been recommended. There are commercial products such as Zicam that have the zinc with the vitamin C. However, there have been some anecdotal stories. So patients taking black elderberry and they're COVID positive have worsened. Ibuprofen is worsening the COVID symptoms. Steroids is worsening the symptoms of COVID. So more natural things such as ginger and honey are acceptable ways to kind of cope with the symptoms, and also to keep you a little healthier. Ginger and honey and lemon have antioxidants in it, which helps as well. So definitely you want to incorporate those into the diet. Eating green leafy vegetables, making sure you're getting your fruits. So when I say fruits, I mean berries. They're low in sugar, but they're really high.
Yeah.
Yeah, strawberries, blueberries, raspberries, blackberries. You can put it in a smoothie and hide it if you want to, but those are going to be really, really essential to help to increase your antioxidants and boost your minerals and your vitamins, because those all are the building blocks of a healthy immune system. And of course, water.
Yeah.
Drink your water. 4 to 6 bottles is where most people should be every day. and majority of us do not get that amount. But making sure that you're well hydrated and that your body is in a healthier state, as healthy as it can be, is definitely going to be a good way to fight the coronavirus.
What are some of the weirdest facts or conspiracy theories you've heard about this virus?
Oh, heavens. Oh, man. There are so many things. The weirdest fact that I hope that we can debunk is that this is not real and that this is a hoax. Um, it is certainly very real, and it is certainly not a hoax at all. The conspiracy theory that this was set up in order for the government to take our money, or to take our freedoms, or to limit us in some sort of a way, is just not true. The COVID-19 is actually killing people and making others very, very sick and very, very ill. So that is the number one conspiracy theory that I hope we can just push into a river and allow it to go down the road, because bye-bye, that this isn't real, because people feel if they don't have a friend or a neighbor or a loved one that has had the virus, that it's not a real condition, and that the government is trying to limit our freedoms. Or it's the other one is that it's the 5G network that is causing this condition. So I have no earthly clue, and it just popped up very randomly. But so a lot of the people who are affected by coronavirus are doing well, and they're recovering. We have recovered plenty of people here in the state of Delaware. However, the people who are dying, it's very random. It's not predictable. It's very sudden, and that's what the problem is. And if we could predict it, and we could say everyone that has straight hair that curls in the morning, and we can say those are the people who are going to die.
Right.
Then all of our straight hair curl in the morning friends would understand that they are at risk.
Right.
But the problem is that the people who are more at risk, most at risk, don't know they are, or sometimes are reluctant to get the care or to test because they don't want to know. And so that just increases the risk all of the more, because the longer you wait to seek care, the more likely it is that you need critical care. And once we know very clearly, the people who go on to ventilators for care are more likely to have poor outcomes.
Wow.
And not actually make it off of the ventilators alive and back to their families. So it's the fact that they're so unpredictable that makes it very hard for us to really digest. And I kind of think that the hoax, I'm hoping that it came out of desperation of us not wanting to face the fact that this is occurring, and that it is scary when you can't predict who's going to die. And are you going to die? Is it going to be your family member? And even now, is it going to be your child that passes away from this condition? And so I'm hoping that that's something that we can take off of the table, that this is real, and this is something that you have to pay attention to, and this is something that you have to understand is real.
Right.
And the way to really stop it is to stay at home. I know it's boring. I know we all kind of are stir crazy by now. We want to go and do as we please, but you
Right.
can't go any place if you're dead.
Right.
And the other thing is, you probably can't go to your family member's funeral because
Right.
there's a limit on how many people can go. So I definitely prefer to stay in the house. So when I'm not out and trying to help the citizens of Wilmington and Delaware as a larger community, I am home on my couch, in my bed, in my favorite comfortable chair.
'Cause everybody has one of those.
Yes, ma'am. And I've been eating my berries and making sure that I am taking care of myself. So that way, I'm here for my family and my loved ones who would miss me if I were, deciding to go out and just be, a little careless
Right.
because I wanted to, exercise my rights as an American to go and do as I please.
Right.
So, yes, I stay home. That's where you can definitely find me.
Now, do you know anyone or has any of your patients passed away from the virus?
So, none of our patients have passed away from the virus. We have had plenty of patients who we've tested positive and have had to be hospitalized, but thankfully those patients have done very well and been able to go home and not need ventilators and those sorts of things. So that's another reason why I say you should seek care early, because if your oxygen level drops, we can give you supplemental oxygen, and sometimes it's hours, sometimes it's days, and
Right.
then you don't need to go on a ventilator. But if your oxygen level continues to drop, then your body makes a lot of different changes in the gases inside of your body, and that will cause you to end up needing to be on a ventilator. So sometimes just going to the hospital early, getting a little bit of oxygen through a nasal cannula, nothing invasive, can save you from needing to be on the ventilator. So we want people to intervene very early. So we have not had any patients that have passed away from um, coronavirus. And we follow up on our patients very often.
Mhm.
So if there's a change in your condition, we can know about it and we can direct you earlier um, to the best care for you. So a lot of times, majority of our patients, they stay home, they do very well. We talk about coughing and deep breathing and opening up your lungs, making sure that you're not taking your ibuprofen, making sure that you are taking the Tylenol if you're having fevers or chills, making sure we have patients that we're like, listen, if your lungs are feeling tight, sing, get in the shower, do your steam baths and those sorts of things. Make sure you're doing your ginger, your lemon tea, and you're keeping your fluids up. That's one of our interventions for everything. Make sure you drink your water.
Yeah.
But we make sure that we follow up with our patients because once you have COVID, it is just making sure that your symptoms are controlled and making sure that if you deteriorate or if you start to do worse, that we get you to the hospital immediately, so that way you're taken care of and we can intervene earlier so we don't have to do some of those later things such as ventilator care.
How long does the virus usually take to run its course? Is that the 14 days? That's how long it usually takes?
So that is another question that we don't have all of the information for. So it is variable. So many places say 14 days is the usual course. However, there are courses 21 days. We have had patients who are positive for over 30 days.
Oh, wow.
We've had people who um, have been sick for an entire month and have not improved yet fully. And after your course of your virus the state of Delaware does clear you as a recovered person. And we have people who we still can't recover because they're continuing to have symptoms. So it's very different depending on the patient. And so the typical, everyone says 14 days. However, sometimes the people don't fit into that mold. So we end up having to treat them for much longer and monitor them, unfortunately, for much longer. And some people never even knew they had it.
Right.
They, started to have maybe a stuffy nose and, a little bit of a cough, and their, say, mother was positive. So they came in to be tested and they're positive, and they have nothing more than the runny nose and the little cough that they did have.
Wow.
So that's kind of the interesting part of this virus, is how variable it is.
Yeah. Wow. How do you get cleared? Do you just get tested again, or do you just get cleared after you no longer have symptoms?
Yes, you're cleared after you no longer have symptoms for 7 days.
Okay.
And then the state of Delaware clears you to return back to your normal activities. So that would be for essential workers to return back to work. Healthcare workers, you can return back to work. And while you're still wearing a mask for healthcare providers, or any hospital worker, if you're a healthcare worker, if you are found to be positive with the COVID, you have to wear a mask for 14 days once you return back to work for all your interactions. But yes, the state of Delaware clears you after you no longer have symptoms. We are not currently retesting patients. The hospital will retest patients when they're attempting to clear them to return home, or throughout their clinical course as it's indicated. However, as outpatient clinics, we are not retesting patients. There are some patients who have returned because they're being required to have the testing and things like that through their jobs. However, that's not a good use of resources, especially when we have a shortage. As it goes. We need to kind of save those resources for the patients who are symptomatic and are kind of at the beginning of their course. So that way we're able to actually test people to determine what the cause of their illness is.
Yeah. And my last question is, I know when this all first started, people had the jokes of, if your mom stored her fish grease on the stove, then you know you're not going to get the virus, right? Black people don't get the virus, right? But now that narrative has changed. If you ate a fried corner, you're not going to get the virus. Yeah. Now it's changed. Now it seems like, now it's like targeted it, right? So
yes.
What fed into that narrative?
Well, I think what fed into the narrative is that there are Black travelers to China and to Italy and all those different places. The majority of Black Americans are not traveling to those areas, especially around the time when Corona started. And so there are Black travelers to those areas, but majority of the folks, especially during the wintertime, you're home, you're working, you have, the holidays that are going on, so you're more stationary during those times. And so the information that was coming out of China was more indicative of, Chinese or maybe Caucasian or different ethnic groups, but they did not include a lot of information on the African populations that they have there. And so I think that helped people to say, oh, we're not going to get it. Then there was an article on Facebook that came out that said that, the Chinese believe that Africans would not or could not get the virus because of their melanin.
Mm.
And then in Africa, there were cases of corona, but it started with people who traveled from other countries into the countries inside of Africa who were Irish or Chinese. And so it was felt that it wasn't there before and that it, would not survive there because of the heat. And everyone's like, over 80 degrees, it cannot survive. But if you have a fever of 101 and it's still there, it's clear that it can survive. But yes, I think it was just the fact that we didn't have a lot of information about the virus that led to those assumptions. And so now it's turned into where a lot of major cities are finding that African Americans are dying at higher rates. And I know Governor Carney said that they are waiting for the racial breakdown for the state of Delaware. So it'll be interesting to see what it looks like here in our state, especially. They do have some really good, helpful mappings from the state of Delaware that you can find that show the heavier concentrations of positive tests within the state. But it'll be interesting to see that racial breakdown.
To see the actual statistics.
Yes, to see what it actually looks like. I'm hopeful that it's different here in Delaware because I'm hoping that patients are getting tested, one, and that they are, able to give us clear information on who is testing positive, because that will help to testing as well. So if we know that the patients in the inner city Wilmington who happen to be African American are testing positive more frequently, then we should start to test those patients more,
right?
Because we're aware that they are testing positive at higher rates. And so I think it's very helpful. Any information that we get about the virus is going to be so helpful in steering testing and really helping us with evaluation of patients when they come in. So if you see an African-American patient and they say, I've been coughing for the last 2 weeks, you can't just assume it's a regular pneumonia. Check them for COVID-19 as well. So I'm really interested to see that data for sure.
Do you have any final thoughts, any tips or words of encouragement for my gummies?
So yes, words of encouragement, because I think that's what we really, really need, because everything is shock and awe and be afraid and don't go out your house because you're gonna die, which isn't far from the truth. However, let's talk about something positive. Is that a lot of people are recovering, and they're recovering on their own because their body is able to fight this condition. And we have followed the trend where the patients that are passing away are elderly, unfortunately, which is good for our communities because a lot of the communities are seeing very young patients passing away. So that can put us at ease a bit. And we look forward to the time where we can go back out, but we have to make sure that it's safe when we do try to go out. And then also be encouraged that the community, as far as the healthcare community, the government, as far as our state and local governments, are doing everything that we possibly can to make sure everybody is taken care of. And this is really deep in the hearts and souls of the people who are trying to solve the problem and to make sure that everyone is being taken care of. So no one is being forgotten. And we are the state is really helping with testing to make sure that everyone has the ability to test if they're willing to test patients. So that's why it's very important for me, for us to let especially the Wilmington community, because that's where we're nestled, is that they know that there's a site that's available, and we are available 7 days a week, 12 hours every single day, to make sure that they are completely taken care of, and giving them those evaluations, not just testing for COVID, and then you still have strep or flu, and so you're still feeling ill, but making sure that you don't have anything that is left untreated at all. So the biggest thing that I want to leave the gummies with is that people are doing well, and people are definitely being hospitalized at a lower rate than what we anticipated, and people are doing a lot better than we anticipated. And so we're in a good spot, and what we're doing, even though it is uncomfortable, it's working. It really is working, and it's the best thing for all of us. And think about, what you're doing is helping your neighbor, it's helping, even your mother or your father or your grandparents, so that way they're not exposed as much. But we're doing well as a community. So I think that's the most positive thing, I think, about this entire situation.
Awesome. Thank you so much. I appreciate you.
Well, I appreciate you inviting us back to
Yeah.
be with your gummies.
And I just want to say to you and your partner and your staff, thank you so much for being on the front line, because like I said, I know that the hours that you spend caring for other family members, that's time away from your family. So we just appreciate you for showing up every day. And you have such a beautiful spirit. You really do. You have such a beautiful
Oh,
spirit.
thank you so much.
Absolutely. And so we appreciate you guys for doing what you're doing, for being pioneers in Wilmington, because you guys are the first and the only, right? The clinic, the
Yes,
walk-in clinic
still
in Wilmington. Yes. So we appreciate
the
you.
first and only. And we're happy to be here.
Mm-hmm.
And so that's why, it's so easy for us to show who we are, is because we're happy to be here.
Mm-hmm.
And this is where I grew up. We appreciate you guys appreciating us.
Yeah.
Thank you to the community for allowing us to take care of you and trusting us to take care of you, because it's our pleasure. Chick-fil-A.
Yes.
My pleasure. It is. And when we went to hire our first employees, we talked to a hiring manager at Chick-fil-A, that we, bought people who were passionate about care, especially in the city of Wilmington. All of our staff, oh my heavens, we have been here till midnight seeing patients, because there's been so many patients that need to be seen.
Wow.
We are so grateful for them, because they are relentless when it comes to the city of Wilmington. Even when it comes to getting the testing kits, it's not always easy. It is not always easy, and it is a lot of calling and emailing and fighting people for these tests. But we will not relent at all when it comes to the city of Wilmington, because who's going to test the people here?
Right.
And we want to make sure that our community is taken care of. So we're fighting every single day. We're tired, but we're relentless when it comes to making sure that the city of Wilmington is taken care of.
Awesome. So Bumping My Gums would like to show our appreciation by buying you guys lunch. So I can cash app you $50. You can just send me your
Get out of town.
Yes. Like I said, we definitely want to show appreciation for you guys taking care of us, our families, our loved ones, and future staff.
Well, thank you so much. We greatly appreciate that. We are a company that likes to eat. So what we have been doing is making food. So we buy groceries, so that way everybody has access to nutritious food while they're here at work and things like that. So the appreciation me to you is very high, because you'll help us to purchase groceries for our staff here so we can make them nutritious meals and things while they're here. So thank you. That is so wonderful. That is so kind. That is wonderful.
Yeah, that's our
Thank you
way of
so
showing
much.
love. Like I said, you saw on Facebook where people were saying like, oh, if you're an essential worker, we'll see, I'll treat you to lunch or whatever. And
Yes.
I started to do that, but then I was like, well, I have people who are coming on to talk to us, so I'll show my appreciation that way too.
Yes.
Yes, and like I said, to let you know how much we appreciate what you are
Why,
doing
thank you
there.
so much. I'm so excited. Thank you so much. That is so great.
Not a problem at all, but